Hi, I'm Shayla Bergman. I'm the Program Director for the Pediatric Hematology Oncology Fellowship here at the Medical University of South Carolina. I'd like to introduce you to our team and to our program, as well as give you a tour of our facilities. I hate that we can't do this in person, but let's go.
Our fellowship program is special and unique in the opportunities that are available for a fellow to learn both oncology, the full spectrum of cancers in children, and the full spectrum of blood disorders in children.
Fellows are an absolute integral part of our program. We really take it very seriously. When they graduate, we want them to be critical thinkers, to be able to handle all the usual things that come up, but also be able to, what I say, critically think and also have some logical creativity for those really tough situations that there really is no standard of care.
Starting off, you have tons of support. Everybody from ancillary staff to nursing to our co-fellows and attendings, everybody really looks out for you and helps support you from day one.
MUSC in particular has somewhat of a small program feel as far as the faculty being very approachable and willing to sit down, always willing to take the time to teach, but also with a medium to large size volume and also a very strong bone marrow transplant program, which is one of the things that attracted me to the program itself.
I was just immediately drawn to how supportive everyone seemed in the program. They really seemed to work really well as a team, working with kids that are as sick as our kids are. With the little experience that I had had before fellowship, I really knew how important that was in their care and their coordination of care. And so seeing how the attendings work so well with the fellows and the nurses and the social work, the pharmacy team, that was one of the really big points that drew me to this program.
We have a brand new children's hospital that it was open this year, and we are very excited. The feature that I like the most is the fact that both outpatient and inpatient are on the same floor.
We have a really specialized design on the 10th floor, our Cancer and Blood Disorders unit. We're in a brand new facility with beautiful views in our beautiful low country, with 6 transplant rooms and everything we need to be part of the state's only transplant program and only immunotherapy program.
Every single room in our clinic and in our inpatient unit has a view of the water. The university recognized that our patients stay in the hospital much longer than other patients, and we got prime location on the 10th floor.
Seeing the building off in the distance when you pull up is always something that I don't know if I'll ever get used to it. The excitement of coming to work is definitely lifted up based on how awesome the new facilities and everything are.
Our culture is absolutely dependent on teamwork and speaking up. And so we really empower every single team member, fellow, resident, nutritionist, pharmacist, nurse, social worker, speak up. If you've got a concern, you're seeing something, speak up, because that's how we grow and get better together, and that's how we drive those amazing outcomes that we have. We've been consistently ranked in the top 50 cancer programs by U.S. News & World Report, and then when U.S. News & World Report breaks that down to outcomes alone, we're actually 15th in the country, which is really phenomenal for the size program. Additionally, for our blood and marrow transplant program, we're ranked in the top 10% in the country in terms of outcomes as rated by the CIBMTR. We're the state's only immunotherapy and CAR T center, and we're very, very proud to have a special clinic for our sickle cell patients and to be offer a number of clinical trials for both disease-modifying therapy as well as disease-curative therapy.
What I really like about the program here is they adapt and allow you to kind of establish yourself. And I think I'm a person that really likes autonomy and thrives in that environment. And so I feel like my attendings did a great job of recognizing that, helping me still grow, but allowing me to really have a ton of autonomy moving forward.
It's really hands-on, and the fact that we're a relatively small program, we really have a lot of interactions with our attendings. We're all real approachable. We have a really large variety of patients, and fellows have a lot of autonomy. They're very involved in deciding the care plans for their patients, so I think that's pretty unique.
As I progressed through my fellowship, I got a lot more supervision in my first year, and as I went through the end of my first year and into my third year, I find myself doing a lot more decision making, obviously with the support and backup of my attendings,
but usually I'll have a plan as opposed to an attending telling me.
I've been here for the last 5 years now. I was a fellow. The main reason I came to Charleston was, especially this program, was the kind of people I met while interviewing. We are such a close-knit family, and we work like very well close together.
For me as a fellow, everybody that you work with here, they're not just your coworkers or colleagues, but also people that you can rely on. They really are like an extension of your family, and I already feel like a part of that, even though I'm brand new. So.
I love this place. That's why I became an attending here. I trained as a fellow for 3 years, and I felt that the fellows are very well incorporated into the program. Also, as an attending, I try to model the way my attendings model for me to be the best I can every day for them, teach them, and also give them the opportunity for them to teach me.
It's a culture of family, a culture of compassion. I've been here 40 years since I was an intern, and I know every patient, and it's just been wonderful to have the opportunity to care for children from birth until their adult years. I hope to share my knowledge and experience with fellows that come and train with us.
The people that you get to meet and work with every day, they are incredibly smart, incredibly passionate about what they do, but at the end of the day, it does feel like a family, and I wouldn't trade that for anything in the world.